Hey guys, welcome back to my channel at Peds Nurse Danny. Today I want to talk about fever, pediatric fever. So fever itself is not always an emergency. I do remember and triage getting a lot of anxious parents bringing their kids in with fever, and that was the biggest thing they were concerned about, was the temperature and the number on the thermometer. The children typically had an associated symptom such as runny nose, cough, earache, or a gastro type illness, diarrhea and vomiting, which would indicate that it is most likely a viral infection. And there's really no treatment for viral infections, and it's just really time. And the most important thing we can do for the viral infections is symptom management. So controlling the fever. So we can give antipyretics, Advil, Tylenol, and that's just mostly to keep the child comfortable, because having a fever really makes a kid feel crappy and can make them very tired and lethargic. So we did get a lot of parents come in and say, oh, I didn't give them the Advil or Tylenol. And they say, like, I wanted you to see that he has a fever. And we're like, we believe you. Give them the Advil, Tylenol, because you'll see a big difference in their behavior. They'll perk right up, and they can keep trucking along with their day. If it is, there are a couple exceptions. So if it is a fever that has been ongoing for 5 days or so, and there's no other symptoms, no runny nose, no cough, nothing that you can see, it's just the fever, then that would be something that's maybe a little more worrisome and would warrant some more investigations by your doctor. Or if you don't have a doctor, you may have to go to the emergency department. Other red flags would be if your child is actually immunocompromised, if they've got a known immunocompromised disorder such as sickle cell disease, or if they are an oncology patient, which I'm sure all the oncology families know this already. If any time that those children have a fever, they need to see their doctor or usually go to the emergency department. Also, children under the age of 3 months have a very immature immune system. So a child under the age of 3 months with a fever, even if they have a runny nose, cough, needs to go to the emergency department, because the odds are it is just viral, but we need to be really careful with these babies because they can get really sick really quickly. So they typically need blood work, urine tests, and possibly lumbar puncture to rule out meningitis, urine infection, and any blood infection. Other things that could be more worrisome too are if the child has a pinpoint rash along with fever. So it looks like broken blood vessels under the skin, and they have fever and no other symptoms as well. That would warrant more of an investigation and possibly blood work. But for most of the time, all these fevers, especially with other symptoms, cough, cold, they are just viral. There's no need to go to the emergency department, and it can be managed at home with antipyretics, Advil, Tylenol. Always follow the dosing, or you can use weight-based dosing that the hospital gives you as well. And keep them home. You don't want to give them the bugs all the other bugs that are living at the emergency department. All this being said, trust your gut as a parent. Not everyone picks up on some of the things that parents pick up on, and you know your child best. So if you are really worried and you're just not sure, I would say go to see a doctor, because better safe than sorry. But I just, in general, didn't want people to panic over fever, and cough and cold season is coming. So I'm sure the fevers and coughs, colds, diarrheas, vomiting, it's all gonna spread like wildfire soon, and I'm expecting it at my house as well with my 2 boys. So if you guys found this content helpful, please like and subscribe to my channel, and feel free to comment and share stories if you're a nurse or a parent, and I'd be happy to respond if you have questions. Thank you so much.